Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
You can also support the show by making a donation. Simply go to our show notes and click the link at the bottom of the page of any episode. Thanks for listening.
We hope you enjoy the show.
Welcome to PetAbility. I'm your host, Kathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Kathy. How are you, my friend?
I'm doing well this morning, Chris. You know, it seems to me that every single time we record, my neighbor is out mowing the lawn. I hope you all can't hear that.
I cannot hear it.
No matter what time of day, no matter what it is.
That Murphy's Law, you know, it gets you every time, right?
I know. Yeah.
So Kathy,
yeah,
we have a really hip show today. See what I did there?
Oh, we have a hip show. Yeah. Wow.
Oh, I'm jazzed because we're talking to a friend of mine, a colleague of mine that I've known for a long time about femoral head and neck osteotomies, which is a fancy term to indicate a type of hip surgery. So we invited Dr. Kechia Davis with us today because she is an expert on all things surgery.
Right. It's exciting. You know, my very first pug that I had avascular necrosis, and he had to have an FHO at like 7 months old.
Wow.
So I'm really, so I have had at least one hand in in FHO surgery with my own personal dog. But I'm interested to learn more.
Yeah. That I didn't realize that Buddha had an FHO.
He did. He lived the rest of his life with one hip. Didn't slow him down at all.
Right. So this is all the stuff we want to share with our audience, because we call it an FHO because, as you heard, you know, femoral head and neck osteotomy is kind of a tongue twister. So throughout the show, we'll be just referring to it as FHO. But we asked Dr. Kechia Davis to be here because it's a very common surgery. And we've been trying to get somebody to talk to us about this topic for a long time. And particularly, it's the type of surgery that really benefits from rehabilitation. So Kathy, both you and I are very familiar with the post-operative rehab protocols following an FHO surgery over the years. Yeah, definitely. I'll go so far as to say, you know, needs rehab for the best outcome following this type of surgery. But many people don't have that privilege. So anyway, we're going to tell you more about it. What is an FHO? Why is an FHO performed? Who are the candidates that are ideal for this? And what should you expect from it? What is the immediate post-op recovery like? What are the long-term outcomes and so forth? But before we get into all of that, let me tell you a little bit more about Dr. Davis. As I mentioned, I think we met in about 2008. Where we were both working in a 24/7 emergency and specialty center. And I remember when Dr. Davis came on board, and shortly thereafter, she actually asked me to participate in a study. And nobody had asked me that before. And so, I was getting excited. I was also terrified because I hate research, but she calmed me down. She said, no, it's not going to be a big deal. We're just going to take some measurements and this is the thing. So I also know that Dr. Davis is a fan of rehab because she definitely referred a lot of pets to me at that time. But getting into some of the nitty gritty, Dr. Davis is a specialist in surgery. And in fact, she is board certified in small animal surgery, which we've said before is a very big deal. So this means that she's a licensed veterinarian who has obtained intensive additional surgical training. She started practicing in 1999 after graduating from New York State Veterinary College at Cornell University. And had a number of stints. She worked a bit in California. She had an internship at North Carolina State University Veterinary Medical Teaching Hospital. then went on to get a fellowship at the Comparative Orthopedic Research Laboratory at the University of Wisconsin-Madison, returned to North Carolina State University Veterinary Medical Teaching Hospital and did a residency there. And then in 2007 became board certified by the American College of Veterinary Surgeons and went on to have an appointment as a lecturer in small animal surgery at the University of Florida in Gainesville. And then that's where we met at Massachusetts Veterinary Referral Hospital and worked together for a few years, and is now at VCA South Shore in Quincy, which is south of Boston here. And so she's in our hood, Kathy. And
Yep.
And we have the pleasure of continuing to work with Dr. Davis, who is proficient in all aspects of both soft tissue and orthopedic surgery, and has a special interest in minimally invasive surgeries. But today we're going to be talking about those FHOs.
Right.
So welcome, Dr. Kechia Davis.
Welcome, Dr. Davis.
Hi, thank you for having me, Chris and Kathy. This is quite an honor. It's my first podcast. So thank you.
we won't make it very daunting. This will be fun.
Oh, good. Well, I'm not scared. I trust you. So
all right, here we go. So
this is a topic that's very near and dear to my heart, because I do think that there is a right way to surgically manage these dogs. And I think a lot of it has nothing to do with the surgery, and a lot of it has to do with the rehab, like you were alluding to in the introduction. And so I certainly concur with that.
So Dr. Davis, thank you for that prop there about rehab, but let's get into it. Can you describe in surgical terms what a femoral head and neck osteotomy is, and further, why is it performed? What are the indications?
Yeah, so an FHO, it's got a couple different names. There's a femoral head and neck ostectomy, and then a femoral head and neck excision. Those are the two most common terms that you'll hear used to describe an FHO. And the purpose of that surgery is to remove the head and the neck of the femur so that there's no longer any contact between the femur and the pelvis. And so for most dogs so the indications for it are if the hip is popped out. Let's say the dog was hit by a car and the hip popped out, and the hip either can't be put back in because it's been too long, or there's a fracture in the hip, or there's a bunch of arthritis. That would be an indication for the surgery. It's also indicated for dogs with hip dysplasia that either aren't good candidates for a hip replacement, or hip replacement just isn't available, in the area where you live. And it's called a salvage procedure. And what that means is that you've basically sort of given up on the joint. And so you remove the articulation of the joint, the actual function of the joint, and create a false joint that's just supported by muscle. So once the head and neck of the femur are gone, you just have the glutes that are sort of holding the hip together and helping with the motion of that leg.
So if people were to sort of visualize this, if they were to think about the hip as a ball and socket joint, what you're essentially doing is removing that ball that goes into the pelvis. So we're going to remove that piece.
Right. And so it just doesn't touch anymore, and that's usually the part that hurts, is that grinding. So that's gone. And so then you're sort of left with this false joint that the body has to figure out how to get used to. And the recovery can be unpredictable depending on how the body does it. And that's why rehab, is really instrumental, because you can actually train the muscles to do what they're supposed to do.
So I want to explore this a little bit more to help people visualize. So, just in terms of the name, femoral head and neck, and I guess I was saying it wrong. I was saying osteotomy, but it's ostectomy. So the thigh bone is the femur. So that's the first part of the name. And then the head is that ball that Kathy was describing. And then the neck actually is that little connecting piece from the ball to the thigh bone. And I know in people, coming from the people world, oftentimes when folks break their hip, with like osteoporosis and things when they're older, it's that neck that breaks when they say they've, fallen and broken their hip, or actually probably broke their hip and then fell due to the weak bone. But I know it's really important, Dr. Davis, that in this surgery, that all of that be removed cleanly. If there's any little bit of that neck that's left behind, then that can cause some continuing problems in terms of discomfort and so forth. But basically, what I hear you describing is you're removing anything that could be offending and irritating in that joint. So it's just clean.
That's exactly right. And a lot of time, if there is a surgical failure, it's because there's some little piece of the neck that's left and it just keeps hitting the pelvis, and that's painful. So if you've had a patient that's, done the full rehab and they're still not quite where they should be, it might be due to that. And so the surgery definitely involves, technically, it's good to have an experienced person do the surgery because you can assure that there's been a clean removal of the head and the neck completely. There's a little bump at the very bottom of the neck, sort of where the neck and the thigh bone attach, called the lesser trochanter. And in the past, there was a recommendation to remove that as well to make sure you get the whole thing. But there's been some research sort of looking at that, if it makes a difference. And actually, if you leave that little piece of bone, they do better because the iliopsoas tendon attaches there, and that can help with just recovery of a normal gait and normal range of motion with these dogs. So the surgery itself has changed a little bit over the years, but really not that much. It's a pretty old surgery. It works quite well. And there's a lot of data as far as, how to do it correctly, indications for revising the surgery if things aren't going well.
It's amazing to me that we can even do this with animals, because if I think of a person, we could never do an FHO on a person, right? We could never remove the femoral head and neck of a person and expect them to stand and walk again. So this is really interesting that we can do this, and that we're going to form, this false joint or pseudo joint that's going to, support the dog in walking. And I'm kind of interested to know, is everybody a candidate for that? So let's think about a big dog, a Mastiff. So I see a lot of little dogs with avascular necrosis who have had FHOs. But what about a large dog? Are they candidates for that? Can they have their femoral head and neck removed and still be functional?
Yeah, I kind of want to back up on your comment a little bit about the human side of it, because that's actually where this surgery came from.
Really?
And so before there were hip replacements in people, this was the surgery that they did,
Wow. I did not know that. That is so cool.
And I'm a PT for people, and I never heard of this.
Well, you don't want it.
Yeah.
Because the recovery is pretty unpredictable, which is also true in dogs, but to the point where you do end up with this really odd rolling walk, when you walk, if you don't recover well. And because, we stand up to walk, dogs, have four legs, they are on all four, the gait is different. So it works functionally better in dogs versus in a person. It just doesn't work nearly as well. So the surgery was done for years and years. The recovery was, it wasn't great. You would end up disabled because you really couldn't function well with that hip. So you weren't in pain, but you still couldn't get around, and then that itself did cause some discomfort as well. So that's why the hip replacements sort of came into fruition, and they were intensively hip replacements trialed through dogs first, which is interesting, before in people. And so there's sort of this cycle between humans and dogs as far as figuring out hip dysplasia, because people get it too, figuring out the best treatment for it. As far as good candidates for an FHO, my personal bias is that, I like an FHO for a very young dog, for a lean dog, typically a smaller dog. For cats, they seem to work predictably pretty well. Some of the really tiny dogs that have avascular necrosis, like the little Malteses, Yorkies, sometimes they don't recover very well. Some of it is due to the amount of muscle loss they have, just because their leg has been so small for so long. It's not trauma. It's sort of this chronic condition. And some of it is also just due to the fact that they're so little. Even if the leg has perfect range of motion, everything is beautiful, they just don't want to use it. It's annoying, So for little dogs, their recovery can be unpredictable, but usually with time they get back to normal. With larger dogs, so any dog over 40 pounds. The bias that I have, because I was trained in a place that did hip replacements, and sort of depending on where you're trained, it really depends on how you think about this, but larger dogs don't do as well. There's a little bit of research out there that says that this might not be true, but they're pretty small studies, like 40 dogs, 60 dogs, really nothing big and massive. And the problem is with large dogs, they're just so heavy. You're expecting this false hip to carry all that weight, and they don't have a predictable recovery, and if they don't recover well, then you have a 100, 150 pound dog that you have to help get around. So it's a big deal, So for those dogs, unless there's some reason they can't have a hip replacement, I do encourage them to get a hip replacement just because the recovery is more predictable. You're talking about a 90, 95% chance of recovery with a hip replacement. Those are the numbers you want to see with a 150 pound dog. We've
talked a little bit and mentioned this false joint or pseudo joint. Can we explain to the audience, or can you explain to the audience what is this false joint?
So basically the head and neck of the femur serve as sort of the bridge between the thigh and the pelvis. And if you remove that, then there's nothing really connecting the back leg to the pelvis as far as bones go. And so you're just really relying on the muscle to sort of take over that motion. And because it's not as stiff as bone, it's just muscle, the movement can be erratic. So you end up with a joint that has way more movement than a traditional hip joint would have. Eventually, the body will develop a bunch of scar tissue around that and try to regulate that. And that's what's considered the false joint, where there's a scar tissue there trying to hold things relatively close together. You do end up with the limb in a little bit of a different position than if the hip were intact. So the leg ends up being a little bit shorter because there's nothing to prevent it from migrating up because that bridge is gone. It's not enough where you would really notice it if you saw the dog walking, but if you took an x-ray, you would see it. And so that's sort of the false joint where the body's just laying down a ton of scar tissue just to keep that leg stable. And so the more muscle you have around that area, the more robust that false joint is going to be, versus if we have really thin muscle, there's just nothing to control that motion. And you end up with far less scar tissue. And also with rehab, you can help control how that scar tissue is laid down. So for my patients, I like them to go into rehab within that first week of surgery. So their body's not so busy laying down scar tissue erratically. We can sort of train it to lay it down in a way that's going to be beneficial for the pet long term.
And that makes that scar tissue stronger too, right?
Right.
I always remember, I don't remember very much from PT school, but Wolf's Law always haunts me. And that's basically when you apply a stress or a strain across tissue, then the tissue responds in a way to resist that stress and strain, I guess, and become stronger in those planes of motion and so forth. Am I explaining that correctly?
Exactly. And that's what you want, because then you know what you have at the end of recovery versus you just sort of get what you get, depending on how the dog wants to move.
I remember also an analogy that was used was like a pile of pickup sticks. And if a trauma, is left to its own devices to heal, or in this case, the surgery is very traumatic because you're going very deep down into the body and through many layers of tissue, but that scar will lay down in just a mishmash form like a pile of pickup sticks. But what rehab and proper movement does is similar to like rolling your hand across that pile of pickup sticks. And eventually they all become lined up in a linear way. And so that was always a good visual. I could kind of explain to my pet owners and such what we're trying to do with some of the rehab protocols.
Never heard that. That's pretty cool. That makes total sense.
Yeah, you got it?
Yeah, thanks. Thanks.
I can picture it. Yeah.
I'm learning today. I love it.
Hey, I want to go back to, we've mentioned, you mentioned a bit early on, Kathy, with Buddha, your pet, that he had avascular necrosis. And Dr. Davis, you mentioned it too, with these really small dogs, which are kind of prone to this, but we've never explained what that is. And I don't think probably the average pet parent has any idea. It's a kind of a technical term. Do you want to explain that, Dr. Davis?
Yeah, that's kind of an interesting syndrome. It's, again, something they see in people. And so what it is, so that if you visualize the hip as sort of this ball and socket, if you just think about the ball part of the hip and the neck of the femur, when the hip is developing, when they're really young, there's growth plates all through there. So the head and the neck and the thigh bone, they're not really firmly connected until the dog is 100% done growing. And so during that growing process, there are blood vessels that travel from the femur, from the thigh, up the neck and into the head. And that those blood vessels just feed that bone so it can grow and develop into a normal bone. And what we think happens is that these dogs throw blood clots when they're really little to those blood vessels in the neck. And that just basically kills the bone from the neck to the head of the femur because they're just all clotted and blood can't get through. And so instead of the bone growing and developing, it just starts to die away. And so eventually that gets so weak that the dog is doing something normal, like walking or jumping or, running across the field, and they can actually break the neck because it just gets brittle because it's just dead bone in there. And so when you take an x-ray, you'll see it just looks like it's sort of been moth-eaten, or they call it like apple coring of the neck and the head of the femur, where it just looks like it's disintegrating. And that's because the bone itself has lost its blood supply. And so there's nothing you can do to reestablish that. People have done all kinds of, studies and have looked at it. And in a person, what they would say is, okay, that's done, we'll give you a hip replacement. And they'll do that sometimes in young kids. And then as they grow, sometimes you have to sort of upsize the hip. In dogs, typically when we see them, they're already almost their adult size. So you can just do this FHO procedure. And most of these dogs are tiny. So there are tiny hip replacements out there, but the vast majority of the dogs with this syndrome don't end up getting hip replacements for a number of reasons. And the FHO is the treatment of choice. And it just takes away that grinding from the dead bone that's there in the hip socket. And so those dogs are much more comfortable after surgery. And then that, I think, is when the real work starts, because the surgery lasts half an hour. And then you have months of recovery where you're just trying to train them to get back on that leg.
This happened exactly with Buddha, just like you described it. He was playing with one of his dog friends. Everything was fine. He tried to jump up on the couch and screamed, and it fractured just like that. Yeah. And then radiographically, it was moth-eaten, I would say, based on its appearance. And he did so well with it. This was my first experience within a first, the surgeon had said, we can do rehab. He said the same thing. I'd like to start in a week, but I'd like you to keep him, a little bit quiet initially. And he felt so much better initially. Dr. Davis, I cried trying to keep him still. I mean, you never tell a pug to do anything, first of all. First rule of pugs, don't tell them to do anything. It was harder than I expected, to keep him quiet. But once we started therapy, there were so many things that we could do. Yeah. It was actually a really cool, recovery and experience to rehab my own dog.
Yeah, and I don't always tell them to be quiet. I mean, most surgeries, you don't want them running around, but they do better if you let them be puppies to some extent, not totally crazy, but they really need to get back on that leg, Yeah. So this is one of the few surgeries where I think it's better if you're a little non-compliant, There aren't that many.
Good. Thank God. Good.
Where it's like, if you, ran across and chased a squirrel and used that leg, I'm all about that,
Yeah. So, I mean, essentially there's nothing to really, break down, right? I mean, there's nothing. Yeah. Okay.
Well, there's like when you do the surgery, there's sometimes you cut through one of the tendons on the glute muscles. And it's a pretty important tendon just to get access to do the surgery. And that could break down if they're just too crazy afterwards. Mm-hmm. But having said that, I, for one, I think maybe I saw one case of that since 2007. Like, it's just not that common. It's, what's more common, I think, is that they don't get enough rehab after surgery. And so they don't really extend that leg. And that's the key with these guys. and you guys are way more intelligent about this than I am, but, I was taught if they never get near normal or normal extension, they're not really going to walk very well. They're always going to have this short stride. And so, that is by far, I think, the most common complication, if you can call that, or just consequence of the surgery, is they don't, pull that leg back far enough during the rehab process, so it all scars down, and they have this really short, choppy gait. That's not painful, but it's not normal, and it doesn't let them return to their full ability to use that leg.
And if you think about, any compensatory related things to posture and gait, that would all be affected by this short stride.
Exactly.
I think there's two big challenges I think of after this surgery for me as a rehabber. And one is just getting them to use that leg at all. So again, they may, run like the wind, but they're on three legs. As we mentioned before, they've got three others, whereas a person only has one other. So especially with the little dogs, they can put so much weight on those front limbs and get around. I've seen dogs literally handstand, which is, crazy and amazing, but not ideal, certainly. So getting them to use that leg. And then the second thing is the whole range of motion concept that you're describing, because I found that, if we do get them in early and, it's that first week and I'm, ranging them and I'm like, wow, they have awesome range of motion. And then by about week 3, 4, they're losing that range of motion because that scar tissue is developing. So, it's kind of a catch-22. We want that scar tissue to develop, but as we were discussing earlier, in the appropriate way. And we can't let them lose, the functional range of motion. And, we talked about this avascular necrosis, which I think they would have a better chance of recovering that range. When you have diagnoses like hip dysplasia, which, leads to osteoarthritis, degenerative joint disease. Oftentimes they've had years of discomfort that, is kind of building up. And then it gets to this threshold where, it's affecting them functionally because they have so much discomfort with that grinding bone, as you described. So they haven't been using that full range, even going into the surgery. And when they lose that range, that extension or bringing that hip back toward the tail is the one that typically is lost first. And then I'd say abduction, or away from the body out to the side, and then external rotation, or kind of pivoting that hip out. That's called a capsular pattern. And that's where they will tend to, that pattern of loss of motion. So it's much more of an uphill battle, I think, when they've had kind of a chronic issue and maybe lost that range going into the surgery. Do you guys have thoughts on that?
Well, Chris, do you remember you and I, way back in the day, we rehabbed an Afghan hound that had an FHO?
Yes.
Yeah, and he never really recovered. And I think that was the scenario. I think he had hip dysplasia. I think he was long-term chronic, and then was referred to physical therapy, but late and at the owner's request. So he was not sent, by the surgeon. And we just never got that leg back to its full function, despite all our efforts, and he did okay. He wasn't in any pain anymore, but it just never got back to full function.
Yeah. And when they don't use it well, through that full range, then they lose that muscle mass. Right. That is so critical, for their maximum improvement, especially, Dr. Davis has referred to the glutes a lot. The gluteal muscles on the back are responsible for extending that leg. They're next to the tail, and when they contract, they bring that leg back. And if they're never doing that motion, those muscles atrophy from disuse. And then you don't have that support, that false joint that is needed. Any further comments, Dr. Davis?
Yeah, I was sort of taught that as well. And I guess there was there's some interesting research that has come out, I would say, I don't know, like in the last 5 years or so, that so to back up a little bit, so to do the surgery, you cut the bone, but then people were sort of trying to figure out a way to prevent what was left of the femur from rubbing on the pelvis. Mm-hmm. So surgeons were trying to figure out like muscular flaps you could do to sort of wedge it in between those two bones so that you don't have the chance of having contact. And what they found was that those muscular flaps didn't really help at all. They just sort of get ground away and they're not that effective. But the dogs that had the more severe arthritis actually ended up doing better. And the thought was it's because they do have a much thicker joint capsule because it's been so inflamed for so long. And so that scar tissue that's already there, you can kind of, when you close it all up, it kind of helps you as a padding between the femur and the pelvis. I don't really know if that's been my experience, but I think I have this bias, kind of like what you were saying, where the leg has just been so abnormal for so long that any function you can get back is great,
Mm-hmm.
But they actually force plated these dogs, and had better outcomes with the more severely arthritic dogs versus like mild arthritis. So that's kind of interesting.
What you're describing with a force plate is that you walk a dog across a plate that measures how much weight, if you will, that they're putting through a limb. So you were saying that the dogs that had more severe arthritis were actually putting more weight on that post-surgical limb than dogs that had less severe arthritis post this surgery.
Right.
Okay.
And there was another study that looked at, this is a really recent one that they looked at dogs that had an FHO like 2 years, a little bit more than 2 years prior. And they would walk them on these force plates to see how they were using the leg, basically, just to find out long-term how they're really doing. Because I feel like, I don't know, I see them at 2 weeks after surgery and then a month, and then they're just gone forever,
Right.
and you don't really know how they're doing. So they looked at them a couple of years later and found that they use the force plate very normally, almost back to normal on the FHO leg. And I think they were larger dogs in this study. However, they had atrophy, muscle loss in the leg, not a ton, but, different than the normal leg. And they had lost some extension of the leg as well. But functionally, when they walked and trotted, they were normal. So I don't know how much of what we see as far as what we can measure is that important for these dogs' quality of life, at the end of the day. Because there's things like, I don't know about you guys, but I want them to all get back to 100% normal, as if nothing had ever happened, right? Like, that's the goal.
Right. None of this ever happened.
I know. It's like, you're just born this way. And you never really get there, right? But I think with this surgery, you probably get closer than you think, if you rehab them early. And the ones that they sit around for a couple months and then go to rehab, those are the ones that I think are the biggest challenge, because you're just fighting against what's already scarred down versus helping the body organize itself.
And I always tell my pet parents too that, again, it's quality of life, it's function. Are they able to do the things that they did, have always done, or that you'd like them to do? And like you said, there's not that many objective things that we can measure as rehabbers. And so when we get out our special tape measure called the Gulick 2 and measure their thigh circumference as a reflection of muscle mass or that potential atrophy, they may always be a centimeter or two smaller on that surgical leg. But at the end of the day, that doesn't matter because they're using that leg great. Or they may still have, 10 degrees less hip extension. Well, the only reason they would need that is if they're, standing on their hind legs and,
right.
Trying to reach up something really high, but for normal, what we call activities of daily living or ADLs, you don't need that last 10 degrees typically. They can get by, So yeah, it's exciting to hear you say that these studies are showing that long-term, they are doing quite well.
Yeah. And I often wonder, so there's atrophy, but like, shouldn't there be, they're using the leg differently. They're not firing these muscles exactly the same, because the mechanics of the leg, if you've made that leg a centimeter shorter, it's not all going to go back to as if it weren't that way, and so like I said, the things that we measure them because that's what we have. But then, at the end of the day, if that dog can just run across the dog park and play endlessly and not hold the leg up, I think it's good. It works for
It's
the
a win.
dog. Right.
Yes.
The win. What about bilateral FHOs? Can we do that?
Yeah. I mean, I can do it, but
I can't
Should
do
you
it.
do it?
but then I ship them off to Chris, and I'm like, all right, can you just fix what I just did? Yeah, I think so. My problem, so I do bilateral FHOs if the dog really isn't walking on the back leg. So if they really can't walk on either back leg and they're so debilitated, I think it's appropriate because you can just really rehab that dog. It's going to be a long slog, and I warn the owners, but you can get them to where they need to be. I prefer to stage them even, 2 to 4 weeks apart, just to give them a good leg, quote unquote, their other bad leg, a good leg to walk on. I've seen a few cases over the years where I'm like, it doesn't matter if you do them separate or together because this dog doesn't have a good leg, So I do that. And I've done it in one instance because the owner really did not have enough money to do them separately, but they end up spending all that money in rehab, So right. I prefer to stage them a little bit, space them out a little bit, just so it's not so hard on the dog. And, in my experience, if they do great on one leg and not the other, the dog is still in pain. Like you haven't really fixed the problem,
I had a client many years ago who called and said that, her dog had bilateral FHOs, at the same time. And the dog was only walking on its front limbs. And so in my mind, I thought, well, it must be a little dog. Maybe it's a little poodle or something. It's just walking on the front legs. This was like a 55 pound shepherd collie mix. And he had lifted up his rear end and was only walking on his front limbs. And ultimately, I would like to say it had a great outcome, because they got the dog into therapy right away and the dog ended up doing just fine. But wow, a 50-pound dog just walking on those front limbs and holding up that back was something to see.
That's so hard for the dog.
It is. And ultimately, again, he ended up doing well, but it was months of therapy, before he was, comfortable. But wow, the ability to compensate the ability to change that or carry how much core strength do you need to carry the rest of your hind end,
Yeah, and you think if you had done one and then given them a couple of weeks just to deal with this post-surgical pain and then do the other,
Well, I was going to say that, I want to touch a little bit about just pointing out the signs that people should look for in terms of, is your dog having hip pain? Sometimes we don't know because it's a gradual onset, over the course of their life. And so it's...
Or your cat, Chris. Or your cat.
Yeah. Because they hide everything. But I'm like, that example you just gave, Kathy, is pretty blatant. If your dog is walking on its front legs, I'd say there's a problem with the hind legs. Yeah, something's going on there. But what are some of the other signs that may be more subtle that people should look for and seek out veterinary care? Get that X-ray, find out what's going on.
The most common signs that I hear about, sometimes the limp. That's a pretty no-brainer. They come in for that, But I learned very early on when I was first out of vet school, before I even started doing surgery, these quote-unquote lazy puppies that lay down to eat, don't stand to drink water. They drink laying down. The ones that go to the dog park and just all the other dogs are running around and they're laying there and they're on their back playing, but they're not running with the other dogs, or they don't run for very long with the other dogs. Those are all signs, really subtle signs of, I think, pretty severe hip pain that the dogs have just sort of learned to compensate because this is all they know, if they have hip dysplasia. And so they don't do normal stuff. So they get called lazy, he doesn't like to, but there's a reason why the puppy's not playing with the other puppies. Like, of course, he should be running around like a maniac,
Yeah.
And he should be standing to eat, that's not normal for them to lay down to eat. So those are some of the big ones that I would say pretty consistently people describe to me. That's not like a limp, or holding up the leg. That would be a clear indication something was wrong. Or reluctance to go up the stairs or jump in the car. I've had owners tell me, oh, he's just scared. And it's like, well, he shouldn't even have a thought about it. He should just go up the stairs, you know. But there was something that happened that made him not want to do it. It probably hurts, you know. And so those are the things that I think are really subtle that owners probably see pretty often. And, you know, once I tell them, they go home and they're like, oh yeah, that's been, you know, it really helps people to know what to look for, because it becomes more obvious. And it is just these little subtle things throughout the day. And once they have the surgery, I'll never forget this one client of mine. She was amazed when she came in for her 2-week recheck because her dog was scratching his ear with the bad leg, and he had never scratched his ear with that leg ever. You know, like little subtle stuff like
something.
that.
Yeah.
Well, and if you only have one dog, for example, you live with this every day, and you just sign off as normal, right? This is just my dog. You don't have anything to compare it to necessarily. So it's our job as rehabbers, veterinarians, to educate pet owners as to what they should expect, what is normal. Because I think a lot of times it is, you know, not consciously are they in denial, but really they unconsciously are in denial that their dog has an issue.
Yeah, you just don't know. I mean, this is all I do all day long since I was 14 years old. Like, I mean, I really don't know anything else. But, you know, but it's just different. But once you start to see these little things, most people can pick up on it. Like, you know, you're like, oh, okay, that makes sense, you know. And
Kathy, you brought up, and Dr. Davis, you did too, about cats. Do cats do well with the FHO surgery?
I do think that they do. I think they actually do better than dogs. And there was, you know, all these gait analysis study. There was one study looking at cats and how they do with FHOs and trying to figure out where they put their weight afterwards. Because the assumption is that they just push it to the other back leg, you know, when they're walking. But cats really distribute their weight differently before and after surgery. They're much more, it's different for every cat. And they tend to do, I think, much better to basically have almost no clinical lameness. But I also think it's hard, very hard to see if a cat is limping just because of how they walk, you know. They're so low to the ground and they're cats, so they just always hide their, you know, any kind of pain. But they typically, if you actually, you know, put them on the force plate, they typically return to almost normal plating afterwards, after surgery, which sort of fits with what you see clinically. So I don't hesitate to do an FHO on a cat. There are total hip replacements that can be done on cats. It's now way more common than it was even 10 years ago. There's implants that are small enough. And some people opt for that. And I'm sure they do excellent, you know, the reports I've seen. But an FHO is also, I think, you know, probably it's not an equivalent alternative, but it's pretty darn close, you know.
Cats are amazing. We always say that. Speaking of which, are there any other species that FHOs have been done on?
There was one paper on wildcats, which that sounds so cool. I was like, I wish I was there.
I want to rehab that, right?
I just want to pet them when they're under anesthesia.
Right.
But I don't know. I mean, you know, I don't know.
I was just curious. And what about age? Is there an age? You know, I know you said that you prefer them to be young and you explained why, but is there an age limit, or are there other medical conditions that would limit your going forth with this type of surgery?
Yeah, so I think a big thing to rule out, or just to make sure before you sort of plow ahead and do any hip surgery, especially on large breed dogs, even small breed dogs, is to make sure the rest of the leg is normal. So, you know, a lot of larger dogs and even smaller dogs will have knee disease. So they'll have like a torn ACL, you know, and that's why they're limping. And the hips are bad, but the hips have been bad since they were 6 months old. And now they're limping at 7 or 8. It might not be the hip, you know, certainly could be the knee, it could be the ankle. And so, you know, in smaller dogs, they have a tendency to have their kneecaps pop out. It's just the way they're sort of built. And so that, again, is another, you know, most people that do hip surgery, you just check out the whole leg first, you know, and just make sure that there's nothing downstream from the hip that could be causing the signs that you're seeing. I have had a few cases where it wasn't anything below the hip, but the nerves weren't normal. And so you have to make sure they don't have any back issues, or they're getting like sciatic pain, like shooting pain to the leg, unrelated to the hip. Because you could certainly have both issues, and you have to sort of figure out which one's bothering the dog. And like I said, if you do have concurrent issues, sometimes it's not like the hips aren't great, but that's not the issue, you know.
And that'd be a bummer to go through the surgery for the hip and then they wouldn't be any better because it was really emanating from their back and the nerves.
And it happens. Yeah.
And then back to age, is there any, you know, if they're healthy, would you do an FHO at on an older dog?
Oh yeah, I wouldn't hesitate, especially, you know, you see some of these older dogs, maybe they're like a little bit weak, you know, over the years, and they fall off the couch and pop their hip out, and they might be a candidate for popping the hip back in. And if the hip stays back in, great, you don't have to do surgery. But if it keeps popping out, that's a good candidate for an FHO. And if they have some other health issues, but nothing too major, I wouldn't hesitate, because again, it provides pain control, you know, and in older dogs where their hips are just so miserably painful, it can provide them some relief. The problem is, you know, especially in some of the large breed older dogs, in particular, I think about Huskies, they'll often have two, you know, horrific hips. And it's like, which one do you fix, you know? And, you know, you could certainly fix both, but that's a lot of surgery for an older dog. And so usually before we sort of go down that path, I encourage owners to do medical management of hip dysplasia. So the big one is almost always weight loss. You know, if you can get even 4 or 5 pounds off of a, you know, a large breed dog, sometimes that's enough to where they just feel amazing and you don't have to do surgery for hip dysplasia. And so, and there's no harm in waiting to do an FHO, because it's not a procedure that needs to be done right away unless the hip is popped out. So you can take a few months, get them to lose the weight, and then if they're not better, do the surgery. But I would say for at least half of the older dogs that I see that come in, you know, and they often have multiple joint issues, the weight loss alone is all you need. Some of them end up coming off of all those anti-inflammatory pills, you know, because they just feel so much better. You actually rehabbed a dog for me, Chris, that had multiple joints. And I told the owner, I'm like, we could do surgery on all 4 legs. Or why don't you just go to rehab for a few months? The dog was fine.
Yeah.
It was fine. Like, you fixed that dog, you know.
Wow. But to your point, well, thank you. But to your point, you know, I think that pet owners underestimate how powerful weight loss is. And the other thing, you know, that I was hearing from you, Dr. Davis, is that I always point out to pet owners, a good surgeon doesn't just jump to surgery. If there are other conservative measures that can be taken to try to, you know, quote unquote, fix the problem. I mean, surgery in and of itself, any type of surgery isn't without risk. I mean, you have risk of anesthesia, you know, there's risk of infection, and, you know, you want to make sure a good surgeon will explore all those other avenues before, you know, they put your dog or pet under the knife. So I appreciate that.
We did a show also. People should go back and listen to the show that we did on obesity so that they can really get a sense for how important it is to keep our dogs in good weight. So if you haven't listened to that show, you should go and listen to the show that we did on obesity.
Yeah. And, you know, it's interesting because weight loss through all the years of research and go back through all the papers has been the only thing that will reliably reduce the severity of arthritis in dogs with hip dysplasia. And it's a really old study, and it was an excellent study. And it was the only thing, and it has been the only thing that will reduce the amount of arthritis in dogs with hip dysplasia. That's it.
Important.
If you just keep them thin, you know, through their whole life, that's huge. You've done more than you ever need to do.
Well, any other questions, Kathy, that you have for the fine doctor?
No, this is great. This is really great. And I have to say, I mean, this makes me a total nerd, I know, but I love rehabbing FHOs. I really love it because it's just so many things that we can do for these dogs. I would say that for the most part, a lot of these dogs do very, very well. So it's an exciting topic for me.
Yeah. There's so many things from a rehab perspective. I mean, this is just a quintessential, issue post-operatively. I mean, we talk about, torn cruciate ligaments. That's a big surgery that we do post-op rehab for, but I think FHOs is right up there. And, again, restoring that range of motion, restoring their gait to a normal pattern, strengthening those muscles to support the hip. And, like you said, Dr. Davis, getting them back out there and running around in that dog park, that's what we're all aiming for. So
nothing feels better than having an owner come back and saying, hey, my dog is doing stuff that they haven't done in a long time, or my dog is reconnecting with something that brings them joy, playing with the dogs, playing with you, that's nothing feels better than that.
Yeah. And Kathy, you always talk about the emotional lives of pets and, getting these guys out of pain. I mean, that really makes them feel much better emotionally.
Yeah, it's a big deal. Yeah.
Yeah, pain is a real drag. Let me tell you,
it's a real bummer.
Yeah, especially chronic pain, right? It's like, well, this has been great, and we always like to finish our show, Dr. Davis, with any closing thoughts or pearls of information that you want to leave our listeners with.
Weight loss.
Oh yeah, that's a good one. Definitely weight loss, and if you end up doing the surgery, I always tell people, the surgery itself is a lot cheaper than getting a hip replacement. So whatever money you save there, just spend it on rehab and you will get what you want out of the surgery. And that's, I think, in my opinion, the two go hand in hand. I don't know why we don't have them in veterinary medicine connected, as part of the treatment, because they should be. They're really not separate, I don't think.
I'm glad you mentioned the cost, because I was going to ask you that earlier, that the FHO surgery is significantly less expensive than hip replacement. And so, that, even though, like you said, maybe pet parents desire to get a hip replacement, but there's nobody doing them in their area, or they just can't afford it, that this definitely is an option. So
yeah, and I think it's a very low risk surgery compared to a hip replacement. If everything goes awry with an FHO, there's really no revision surgery to be done unless it wasn't done correctly the first time, versus a hip replacement. If the hip pops out, then you got to get in there and do something, And so I have had owners who have just enough money for one surgery, just enough. Yeah. And I think this is the surgery that I would pick for them, because no matter what, we're going to be within the budget and they're going to still do a pretty wonderful thing for their pet. So,
well, and I remember working on the human side, and it's very, what do I want to say? There are a lot of precautions post-op in terms of they can't bring their leg across midline, they can't, flex more than X degrees and so forth. And I would think, it's similar in dogs, and based on the personality, the temperament of the dog, and what the owner is capable of, I would think that would be part of the selection process too, because if you have a nutty dog that is getting a total hip replacement, that success, may be challenging because of those restrictions.
I don't know. We put them in military dogs and police dogs.
Yeah.
My residency, I'll never forget this one dog. It literally just circled in the car the whole time, and it was really aggressive. And it was a very hard dog to deal with in the hospital, and that dog did just fine. So the hip replacement is it's pretty robust, but if there's a complication, you got to get back into surgery, and so it's definitely riskier, I think, and if you can't afford the risk, the FHO makes complete sense to me.
And one other thing I wanted to say is that I just want to paint a clear picture, and this is true for really any surgery. I think it's traumatizing for the owners if we don't manage their expectations when they see their dog, when they pick up their dog after surgery. I mean, there is swelling, there is bruising, there's going to be an incision and sutures and so forth. But again, that's, where your immediate post-op care, your rest, your cold packs, and getting into rehab, we can really help to reduce that immediate post-op inflammation and make sure that it doesn't become a chronic issue. But, that's kind of par for the course, I think, with any surgery, whether it's an animal or a person, right? There's that post-op inflammation that needs to be controlled. So
yeah, that's usually the most alarming part, is seeing the leg right after surgery.
Well, Dr. Davis, can you, would you let the audience know, where can they find you? Where can they find you if they want to learn more about FHOs and hips?
I'm at VCA South Shore in South Weymouth. So if you Google that, I should pop right up. So
Yep, we'll put that in our show notes.
So Dr. Davis, I cannot thank you enough for spending the time with us today. You are an expert, and more than that, you are a dynamite person that I'm happy to call my friend as well.
Thanks, Chris. I appreciate it.
Thank you, Dr. Davis. We learned a lot today. Thank you so much.
Bye.
Bye.
Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
For more information about Kathy's books and living with blind dogs, please visit enableyourpet.com. Thank you, and please tune in next time.